Questions 281 to 300. 281. A 34 weeks pregnant mother experiences a sudden gush from her vagina and mild uterine contractions. She informs about her condition and requests if she could wait until the delivery. Which of the following is the best desired response for report to the hospital? A. Intravenous fluids and medicines need to be administered. B. Observation is necessary to identify premature labor. C. Pain and fluid flow both need to be controlled. D. Fetal heart sound monitoring is necessary. The answer is D. Fetal heart sound monitoring is necessary. 282. During a vaginal delivery of woman 38 years old, the nurse should consider the risk of which of the following? A. Acute bleeding and coma. B. Low potassium. C. Brain injury. D. Fetal heart rate. The answer is D. Fetal heart rate. 283. Pregnant woman 34 weeks has hypertension. This problem is identified as A. Hypertension. B. Pregnancy-induced DM. C. PIH, pregnancy-induced hypertension. D. Placenta previa. The answer is C. PIH, pregnancy-induced hypertension. 284. A nurse is explaining to the nursing students working on the antepartum unit how to assess edema. Which edema assessment score indicates edema of the lower extremities, face, hands, and sacral area? A. +1. B. +2. C. +3. D. +4. The answer is C. +3. 285. 38 weeks, pregnant woman complains that she has been craving to eat non-food substance. What is the term that describes this pregnant mother's condition? A. Pica. B. Bulimia. C. Anorexia. D. Binge eating. The answer is A. Pica. 286. Pregnant client is making her first antepartum visit. She has a 2-year-old son born at 40 weeks. A 5-year-old daughter born at 38 weeks and 7-year-old twin daughters born at 35 weeks. She had a spontaneous abortion 3 years ago at 10 weeks. Using the GTPAL format, the nurse should identify that the client is A. G4T3P2A1L4. B. G5T2P2A1L4. C. G5T2P1A1L4. D. A G4T3P1A1L4. The answer is C. G5T2P1A1L4. 287. Multiparous woman is admitted to postpartum ward after vaginal delivery. Assessment showed lochia, steady trickle of bright red blood and fundus, firm. Heart rate 80/min. Temperature 37.5. Blood pressure 110/70 mmHg. Respiratory rate 20/min. Which of the following is the most likely diagnosis? A. Endometritis. B. Uterine atony. C. Vulvar hematoma. D. Laceration of the genital tract. The answer is D. Laceration of the genital tract. 288. A 7-year-old insulin-dependent diabetic mother has delivered normally in 38 gestational weeks. The nurse was assessing the insulin requirement this mother after delivery. What is the insulin requirement for this patient? A. Higher than before pregnancy. B. No changes in insulin requirement. C. Lower than when she was pregnant. D. Slightly increased than before deliver. The answer is C. Lower than when she was pregnant. 289. Mother of 9 children, 3 of them with congenital anomalies and 1 Down syndrome. She is a primary school graduate, with low financial status. She is not using any method of family planning. Accordingly, the primary healthcare nurse has referred her for counseling. Which of the following is a barrier facing the team responsible for providing health services to handicapped individuals? A. Sensory limitations. B. Rigid rules. C. Developmental disabilities. D. Deafness and hearing limitations. The answer is C. Developmental disabilities. 290, mother of 9 children, 3 of them with congenital anomalies and 1 Down syndrome. She is primary school graduate, with low financial status. She is not using any method of family planning. So, the primary healthcare nurse has referred her for counseling. Which of the following is the best health education method that can be used? A. Community organization. B. Individual counseling. C. Group discussion. D. Health class. The answer is B. Individual counseling. 291, multiparous patient on day 1 postpartum is asking the nurse to send her baby to the nursery so she can sleep. What is the most likely phase of psychological adaptation? A. Taking in. B. Letting go. C. Taking go. D. Letting in. The answer is A. Taking in. 292, a post-date pregnant woman is admitted for the induction of labor. Her fetal heart rate and vital signs are within normal range. Her intravenous line is maintained, and she is to be started on low doses of labor-inducing medication. Which of the following medication the mother is likely to receive intravenously? A. Oxytocin. B. Servidol. C. Cytotec. D. Cytoxin. The answer is A. Oxytocin. 293, a 65-year-old woman visited the gynecological outpatient history reveals that she had 3 pregnancies, 1 abortion gestational age, had 2 normal deliveries. She smokes 20, her complaint is that she wets herself when she coughs. Embarrassing for her? Which of the following can be considered as risk factors? Pelvic floor muscles. A. Chronic coughing. B. Diabetes mellitus. C. Excessive spot. D. Sedentary lifestyle. The answer is A. Chronic coughing. 294. At what is the recommended weight gain during pregnancy of a woman with MI of less than 18.5? A. 12.5 to 18 kg. B. 11.5 to 16 kilograms. C. 7 to 11.5 kilograms. D. 5 to 9 kilograms. The answer is A. 12.5 to 18 kg. 295, a 25-year-old mother gravid 2 par Q came for a routine check antenatal clinic. The nurse assessed fetal heart rate for the 38 pregnant mother. What is the expected normal fetal heart rate per minute? A. 90. B. 100. C. 140. D. 170. The answer is C. 140. 296, a woman has polycystic ovary syndrome, which is 3 centimeters in size. What should the nurse do? A. Repeat the ultrasound after menstruation. B. Remove it by laparoscopy. C. Give the medication. D. None. The answer is A. Repeat the ultrasound after menstruation. 297, Nancy, a primipara who is due to deliver next week, calls and tells the nurse she has been having contractions every 4 minutes for an hour. Before asking any further questions, the nurse confirms that Nancy knows how to correctly time contractions, which is A. From the end of one contraction to the beginning of the next. B. From the beginning of one contraction to the end of the next. C. From the end of one contraction to the end of the next. D. From the beginning of one contraction to the beginning of the next. The answer is D. From the beginning of one contraction to the beginning of the next. 298, a 22-year-old gravida 2 par 1 with gestational age 38 week admitted to the hospital. The chief complaint is decreased. The fetal non-stress test revealed decreased variability and fetal movement. The next morning, as part of the antenatal, the nurse checks the fetal heart rate by Doppler Sonicaid, decreased the fetal heart rate to less than 100/min. Which of the following action the nurse should do first? A. Reassure the mother that the FHR is okay. B. Notify immediately the physician or midwife. C. Reposition the patient to left lateral position. D. Ask the mother about the pattern of fetal movement. The answer is B. Notify immediately the physician or midwife. 299. Pregnant patient admission to triage with abdominal pain on assessment. The FHR found 70p/m. What is the first action for the nurse? A. Call the doctor. B. Report the finding. C. Put the patient in left lateral position. The answer is A. Call the doctor. 300. Which of the following statements describe puerperal infection? A. Presence of fever of 38 or higher from 2 days to 10 days. B. Presence of fever of 40. The answer is A. Presence of fever of 38 or higher from 2 days to 10 days.